Hey everybody, welcome back. Got my dad here again. Let's run it back. Dad, how you doing?
I'm doing well, Jader.
Okay, question number one. This one's from Matt Martin. What's your dad's early impression on the percentage of cases that are asymptomatic?
So most of the estimates right now are that about 25% of people don't have symptoms. Now there's a bias there that's 25% overall, but the younger that people are, the higher the probability they could be infected and asymptomatic.
The COVID-19 mortality rate is running at about 8 to 10% of people age 65 and up. So does that mean that we can expect within a couple of years a reduction of our elderly population by about that much worldwide?
Unfortunately, the answer to that question is yes. If there is a persistent infection, that is the rate that group is having. So the higher the proportion of people in that age group get infected, that percent will have a fatal outcome.
This one comes from On Tran from Las Vegas, Nevada. What's up, Treasy? Some doctors in different countries claim that people who get COVID-19 will end up losing 20 to 30% of their lung/breathing capacity. Is this true?
So it's hard to make a specific prediction for any particular person, but it is true that there's substantial damage to the lung, and the more severe disease one has, the more damage that there's been. That said, the human body has a tremendous capacity to regenerate. So for younger people, much of that damage will regenerate. For older people, less so, because we aren't able to regenerate as well as young people can.
Would you say that with young people, it's likely that you'll have 100% recovery and your lungs will recover by 100%?
I would say it would be expected to have 100% recovery. However, some young people have very severe disease, and if one has severe disease, one could have, complicated, it could be fatal, or one could have pulmonary damage that might be chronic or lifelong.
That's intense.
No one's safe. The risk is low, but no one is safe.
Okay. Melissa Florum from Nebraska says, my 20-year-old has pulmonary sarcoidosis. If and when we get this, is chloroquine a good option? There's so much contradicting information out there right now.
So chloroquine is a very complicated question these days. There is some preliminary evidence that suggests that it would work. So if I had a person who was at very high risk of complications and they were not doing well, I would be inclined to give them chloroquine. That said, the studies are ongoing to really determine whether it works or not. Chloroquine, like any other drug, has potential side effects. So one has to balance the known side effects against the unknown benefit. But if someone was having severe disease, I would be inclined to try to use the drug.
Dad, thanks so much. I know that a lot of people out there are very grateful for your words and for your help. So thank you. We'll see you guys next time.